This is Pet Life Radio. Let's talk pets.
This episode of Vet Candy is powered by Sentrx Animal Care, makers of Ocunovis Biohance Gel Eye Drops. Learn more at sentrxanimalcare.com.
Welcome to another episode of Vet Candy's podcast, In Other News. This is a podcast to expand your idea of what is impacting the veterinary world, veterinarians, and all animal care professionals as humans. We are your co-hosts. I am Dr. Jen.
And I am Dr. Jason Chatfield.
And if you are not yet a Vet Candy subscriber,
why not?
Please subscribe for free today at myvetcandy.com. You can also reach me with messages of love and positivity at jen@myvetcandy.com.
Or if you want to speak the truth, I can handle the truth. You can reach me at jason@myvetcandy.com.
Our topic today is corneal ulcers and ophthalmology.
In other news, dogs have to go to the ophthalmologist also? I really thought that was a human thing. What's happening here?
Well, they have eyeballs, right?
2, I think. Most of them have 2. Yes, that's correct. But I thought they outgrew those. I thought that didn't really happen in dogs, and they have to go get their eyes checked out, just like I have to get mine. Although everybody knows I have perfect vision and will always have perfect vision. And so all of you other lesser people have to go to the eye doctor and get their eyes checked out. But that does happen to dogs, I guess.
You have perfect vision. So what explains when your dart misses the creature totally then?
Bad gun. Somebody named, I won't remain nameless, messed with the site because I was doing so good they had to bring me down a little bit. That's the only explanation that is possible. Certainly not my eyesight.
Oh, I'm so sorry. The poor craftsman, once again, blaming his tools. Yeah, no, but dogs have eyes. And so, of course, they have an ophthalmologist, right? They should. I would think. And so, but luckily it's not me because everyone in the Candyverse is aware that there's only 2 things that gross me out. And it's eyeballs and brains, and eyes just gross me out. So I love it.
I actually didn't know that. I'll chalk that up to something I did not know. I was unaware.
Really?
I'm not sure how I can use that in the future, but that's interesting news.
Oh, you're marking that down, are you? Okay.
I'm marking it down, yes, for future.
Yeah. Well, luckily, we don't have to be concerned or grossed out because there are experts.
Yes, there are.
Of course, as per the usual. In Other News is bringing an expert into the Candyverse for everyone. We are joined today by Dr. DJ, get ready for it, Haeussler. Dr. Haeussler, welcome to the Candyverse.
Hey, how are you? Thank you for having me.
I gotta say, coolest name ever. I'm sure you get that a lot, but that is just a cool veterinary. DJ Haeussler. Haeussler. It's very cool.
Nobody can say it, so it can't be really that great. It gets messed up all day, so I'll take any pronunciation that people give me.
Wait, did I mess it up? I said it right.
No, you guys say it perfectly.
Boom! That's because you spelled it for us phonetically. That's the only reason we got it right.
That's right.
That's right. I love it. I love that your email address is like the phonetic spelling of your last name.
It's really good.
I had a license plate with that one for a while.
Yeah. That's awesome. So you're an ophthalmologist, right? And did you graduate from the Ohio State University?
I did. I graduated from the Ohio State University about 3 or 4 times. Yeah.
3 or 4 times.
I was on the remedial course.
Fantastic. Before we get to the eyes, because I know everyone wants to hear about eyes, listen, inquiring minds that don't go to that aforementioned university really want to know what's up with the. Like, what's up with that? Can you explain that? Or is that not something we can get into? Or is it one of those, you got to be part of the club to understand it situation?
The in front of Ohio State University has been trademarked for longer than people realize. It's been around for a long time, but seems like more recently over the last couple decades, they started using it a little bit more often, but pretty much everybody that has gone to school there does not use the. We all just call it Ohio State.
Only when you're on world famous podcasts and news shows, you have to stick it in there just to kind of go with the flow, huh?
That's exactly right. You got to stick the in there. It gives you extra credibility.
I understood. Listen, if I had that, I would do that. All right, moving on. I digress. All right.
Well, I think that we should introduce you appropriately. Then you are the Dr. DJ Haeussler.
I've never had anybody put "the" in front of my name, but I guess so.
But there's another Dr. Haeussler in the veterinary world, isn't there?
There is. There's actually two of them. There's my father, Dr. Dave Haeussler, who is a retired general practitioner, small animal general practitioner. And then there's my wife, Dr. Jamie Haeussler, who is also a small animal veterinarian.
Oh, my gosh. A veterinarian as a wife, that is, I don't want to say anything. That's great. Good deal there.
He doesn't want to say anything, Dr. Haeussler, because he's got to go home.
Yeah.
To his wife, who's a veterinarian.
Yeah. I'm always happy to meet fellow inbreeders like yourself.
Yeah. Great.
That's excellent. That's excellent. Okay, so you went to the Ohio State University, and you have a fair number of. You've got a practice now, like you're, saving eyeballs on a daily basis, right?
Yeah, so I have 3 practices. I have one in Dayton, Ohio, one in Cincinnati, Ohio, and then one in Florence, Kentucky.
Oh, so if you're in Kentucky or Ohio, your dogs or cats, I should say cats have eyeballs too. Your dogs or cats' eyes could be worked on by the DJ Haeussler.
Yeah, we do pretty much everything. Fridays, I spend my time on equine calls as well. So I go out to a lot of farms on Fridays, and that's a good way to get out of the office, look at some other cool critters.
Yeah. Wait a minute. Horses have eye problems?
Indeed.
Yeah, but can't their eye problems sometimes be because the veterinarian or someone sticks their finger all the way up inside the eyelid and rolls it around? Because I've seen that. People do that looking for the foreign body. That's crazy.
I have seen it. I have done that and gone up and looking for stuff, but I've never seen a veterinarian injure an animal that way.
Oh, okay, good. Good to know. Good to know. So I can try it next time.
Only if DJ's watching, because he's got the good
watch. Yeah.
Okay.
You don't want to be case number 1.
Yeah.
Okay. And I digress just a hair here because we really want to talk about corneal ulceration in real. I guess we're going to focus on dogs and cats, but are there any other weird creatures besides horses that you work on, like alligators or birds or what?
Yeah, I've seen. I like to keep a nice list of different creatures I've looked at. So I've looked at a raccoon named Styles that had cataracts. He was pretty neat. I've done surgery on hammerhead sharks. I've looked at shark rays, alligators, bearded dragons, variety of different pocket pets.
Hammerhead sharks got to be interesting, right?
Yeah, those were cool cases to look at those guys. They were pretty interesting. They were little babies when I had to look at those guys. So that was definitely an interesting day.
They're just weird creatures to begin with, right? And that's pretty cool. Awesome.
Yeah, pretty neat stuff. So cows, pigs, horses. Looked at a tiger cub. So yeah, it's neat. It's one of the specialties that you can.
I was going to say, not a tiger king though, right? You only looked at a tiger cub.
I was going to say, I didn't see him on the must not be true because I didn't see him on the video there. So.
I know, I didn't either.
I have never met Carol Baskin, and I've never been on Joe Exotic TV.
There you go.
That's awesome. Okay. So now we got our pop culture reference out of the way, right? Early. So when we're talking about ulcerations, corneal ulcerations in dogs, common or uncommon?
Very common. Probably the most common thing that I see throughout the day.
Okay, so I don't need to feel bad, or other dog owners don't need to feel bad if all of a sudden their dog has a corneal ulcer pop up.
No, not at all. And it's it's probably what I see 60 to 70% of the day, and certainly one of the things that if things are not going well or they are mismanaged in a way, then things get kind of tricky, either surgery or more expensive sort of treatments, things like that. So things are referred quickly and clients bring them in quickly so that they can be addressed.
Yeah. So the one thing I remember about this, I don't know a lot about eyes, but I do know this. I think it's true. I think you just made me feel very smart. They go bad in a hurry. Is that true? Like they can go bad in a hurry.
They can melt.
They go bad in a hurry. So the cornea itself is only about 0.5 millimeters thick. So you don't have a whole lot of time to mess around. So we try to use that as a way to educate veterinarians that this isn't necessarily something you should feel bad about referring immediately if you feel out of your comfort zone, because that is in the best interest of the animal.
Well, wow. Okay, so we're talking about a very, very limited amount of tissue, and we're talking about scraping it, scratching it, ulcerating it. And as soon as we get to the other side of this quick break, then we're going to talk about what to do about it when the dog shows up in the practice. All right, so we're going to pay some bills and we'll be right back. Catch you on the other side.
Does your pet have dry or painful, irritated eyes? If left untreated, dry eyes can lead to further complications, including scarring or even blindness. Ocunovis Biohance gel eye drops are scientifically proven to relieve dry eyes in pets. Our patented, all-natural cross-linked hyaluronic acid-based formulation provides long-lasting lubrication for your pet's eyes. Just apply 1 drop in each eye twice a day to help relieve your pet's dry eyes and keep them happy and comfortable. Learn more at sentrxanimalcare.com. That's SENTRX animalcare.com.
Oh, sure. It's all fun and games until someone ends up in a cone. That's right. We're animals. Deal with it. Pet Life Radio. Let's talk pets.
Okay, welcome back. Welcome back, Newshounds. In the Candyverse today is ophthalmologist, guru, and all-around good guy, Dr. DJ Haeussler. And we were talking all about corneal ulcers, which can go bad in a hurry. Okay, so Dr. Haeussler, if I'm in a general practice and dog comes in, and it comes in because it's either scratching at its eye or it's rubbing it on the carpet or it's got some nastiness draining out of it, right? Has anything changed in diagnosing that ulceration? You know, have we gone beyond like fluorescein staining, or like what am I doing with that?
No, the basics still apply. So there hasn't been a whole lot change in that regard, which is great because that means that we haven't necessarily have to evolve in terms of testing or anything like that. Your big kind of heavy hitters when it comes to a minimum database are Schirmer tear testing, fluorescein staining, tonometry for intraocular pressures, and then a good light source so that you can look.
And like, am I black lighting that? Like, because there's always this discussion because I've done relief in like 1,000 different practices. Like, Jason, do you have a black light in your practice?
We do. Ask me if it comes on. Yeah, I have one. I don't think it works.
Okay. Well, there's always like this thing I've been told by people in other practices. They're like, yeah, you don't need that, and so we don't have it. Do I need a black light?
Yeah, I think you absolutely need a black light so that you can highlight the corneal ulcers. You'll be surprised what you can find with it. So yeah, of course, step number 1 is having a black light, and yeah, step number 2 would be using it. So yeah,
chalk that up to I did poor again. All right, great. Let's move on. Okay, something else I did wrong. Love this show.
Right. I not only do you have to take the reservation, you have to hold the reservation.
Yeah,
right?
True.
Okay. All right. So I'm gonna stain it. So should I do? So if the dog comes in with an eye problem, what you're saying is the minimum things I should do. It shouldn't just be the fluorescein stain. It should be I should have a look at it, right, with my ophthalmoscope, which is rudimentary at best compared to what you're using to look at eyes. And then I should do a Schirmer tear test.
Yeah, you really should. You know, there's a vast majority of ocular diseases missed by not doing Schirmer tear testing. It's amazing how many cases that we see that have low tear production that weren't necessarily clinical for it. Oh. So usually clinical is thought to be the mucoid discharge or corneal vascularization, red eyelids around the eye. But usually if they get to that point, their tear testing is very low, so 10 or less typically in that range. But you can have corneal ulcers with a tear production of 11, 12, 13, and they may not be quote-unquote clinical for it.
Wow.
So a low tear test correlates to more susceptible to ulcers? Is that what you're saying, or did I hear that wrong?
That's right. So you need a good tear production or a good tear film in order to prevent corneal ulceration. So a good way to think about it is if you ride around in a convertible, hold your eyelid open and don't close it and watch how fast it dries out and how painful that is.
Let's vote. Let's take a vote really quick. I vote Jen. Dr. Jen can do that, and we'll time it on her. Is that correct? Okay, 3-0. Look at that. She volunteered. Good for you.
I will not do that. And look just so that the lawyers are all comfortable, don't try that at home. If you try it, you are on your own. We're not involved, right?
We're not endorsing that, but that's a great
analogy.
Analogy. I couldn't think of that word. Very good.
Yeah, you're welcome. Okay, so that's incredible. So can we prevent corneal ulcers then?
So
is that what you're saying?
You can't prevent all corneal ulcers. Some of them are going to be traumatically related. Where you can't prevent that.
Right.
There are some that are going to be associated with eyelid disease, so entropion. Evaluating those animals and correcting the entropion before you get an ulcer, that could be argued that you could prevent those ulcers. So some ulcers
for those listening,
some ulcers can't. If you get, in middle-aged and older dogs, you have indolent ulcers, and there's a argument there that those are spontaneous, and so those can't be prevented either.
Okay, but so for folks
you're going to go ahead and tell us what entropion means. Go ahead, get to it.
For those who are trying to keep up with the drinking game at home, entropion, when the eyelids are rolled inward, right, Dr. DJ?
That's exactly right.
And the eyelashes are scratching against the cornea instead of just sitting lightly outside the eye.
And can you imagine how painful that has to be, right? That's just got to be.
Yeah, so that's a good point. So a lot of pet owners don't realize how painful some of these conditions are, and I usually will ask them, or they'll ask me if it's painful, entropion, and I'll say, yeah. And they'll say, well, he doesn't seem painful, or she doesn't seem painful. And I usually say, well, have you ever had a hair in your eye, and does that hurt? And they say, yeah. And I said, well, okay, well, imagine that is 50 to 100 hairs that are scratching across your cornea every time you blink.
Every single time.
Then we start to understand a little bit better.
Yeah.
But there are certain breeds that are prone to like a congenital entropion, right?
Yeah, so there's a lot of breeds out there that can develop these as they go through their early year and a half. Mm-hmm. Bulldogs are some of the biggest ones. Shar-Peis are another breed.
Big shock.
Can you imagine that Shar-Pei hair? That just feels like cactus needles in your eye.
Yeah, those are rough. Big dogs that have big eyelids, St. Bernards, Newfoundlands, those breeds, Great Danes, they're all very susceptible to entropion.
Okay, interesting. I never thought about the Newfies and the St. Bernards. Okay, so we know some of the things that cause them. So we know we're going to diagnose them because we're going to do that minimum database. And frankly, the Tonopen exists to enrich my life because it's so hard to use effectively consistently, right? Like you got to really do it the same way every time, don't you?
Yeah, it's a learned skill, like anything. So the more you do it, the better you are at it, So yeah, it's like anything,
Says the guy who probably has 10,000 hours.
It's not like anything. Those of you guys that can use those and use them well, kudos to you guys. They can be tricky. So stop downplaying how difficult they are. That's why we have you. We say if I get the point I got is a Tonopen, I am referring this case because I can't do it.
Okay, so we get our minimum database and we say, ulcer. And let's presume for the time being that our Tonopen was excellently employed and it says that our pressure is normal, whatever normal is. And now what?
So I would think the biggest things to look at when you look at these ulcers is the depth of the ulcer. Can you tell if it is deep or if it is superficial? That's one of the biggest sort of gut checks, really, because if you are looking at this and you say, man, that looks like a hole, that looks like a pothole. That's a problem. That needs to be addressed very quickly and very aggressively. Every ulcer technically should be attacked aggressively and in a timely manner. But if you're looking at a hole, I think that's when you start to pay attention a little bit more.
Yeah, and isn't that are you talking about a hole like a desmetocele?
Like a desmetocele, yes.
Mm. Did you hear me popping out, Jason, with the big word? Did you hear it?
Yeah, there's wonders never cease.
So can you describe for us, because I know that desmetocele is like right before the eye starts to melt out, right? It's got like one little layer.
So they're a little bit different. A desmetocele is where 99% of the corneal stroma is eroded until you get down to a layer called Descemet's membrane. And that is, for the veterinarians out there, you are now at the thickness of essentially a neutrophil and before the eye should rupture.
Oh,
pretty quick. He's saying pretty quick.
Pretty quick. So it's coming. So we consider those to be surgical emergencies. They should be referred immediately, and those are typically corrected before I leave the office.
Oh, never let the sun set on a desmetocele.
Never let the sun set on a desmetocele.
That's awesome, right? Never let the sun set on a pyometra, and never let the sun set on the desmetocele.
There you go.
Okay, so all right, so I'm looking at a hole. What is your first choice? Like, what are my choices to treat it, right? Because I had Dr. Dan Wolf is a good friend of mine. He was like my eyeball mentor because he was also my phone a friend, and he's retired now. But he would always say, you got to keep it slippery, right? But what am I going to keep it slippery with? And what am I going to do about an infection and all that? What am I going to do with this eye?
So it's very good to understand what different antibiotics do for the eye and where their spectrum is. Are they broad spectrum? Or are they narrow spectrum? Just as it's important as a veterinarian to know which specific antibiotics will target specific tissues, sure, those are also important for the eye. So one of the things that I always try to teach in CE and things like that is understanding your antibiotics and understanding which ones to use and when to use them. Your ophthalmic medication should consist of way more than just triple antibiotic.
Wait.
Triple antibiotic is not the only antibiotic that's out there.
What?
There's more?
There's a whole lot more. Believe it or not.
I'm doing so bad with eyes. It's a good thing I just boot them on, right? I'm a referral center. All right, just move on. All right.
Yeah. And
fill me in.
I know this is surprising, but I did not do a 3-year residency in how to utilize triple antibiotics.
That's a good point. There's got to be more, right?
Yeah, there's more to it, you know?
The first year was how to take the cap off.
Yeah. Second year is you got to be able to spell the entire label of triple antibiotics. And then we spend a good 6 months learning just how frequently to dose it. And then you're almost done at that point.
You're almost overly educated now. I mean, that's just too much.
Precisely.
Yeah. Okay, but that's interesting. And I will say, shameless plug here on behalf of Dr. DJ about his veterinary ophthalmology CE, which is available for free on myvetcandy.com/CE. So that if you forget what he's about to tell us about these antibiotics, which is apparently the key to saving eyeballs, you can find it there. Okay, so I'm ready to download the info from you. Dr. Haeussler, which is your go-to first-line empirical choice for treating first presentation uncomplicated corneal ulcer?
Okay, so my favorite to use would be ofloxacin. So ofloxacin is a broad-spectrum fluoroquinolone. It's one step above ciprofloxacin, which many people are familiar with. Ciprofloxacin seems to be a little bit more irritating to the eye. Ofloxacin is better tolerated. It's typically dosed at 4 times a day. So one of the things that we see in our referral practice done incorrectly is underdosing. So you have to dose it at 4 times a day to have it be effective.
Can you overdose stuff in the eye?
So you can't really overdose it too much if we're talking about antibiotics. So if we're talking about, if we're talking about a different subset of diseases and you're using steroids, then yes, absolutely, you can overdose them. But when it comes to antibiotics, you can underdose them quite a bit, but it's fairly difficult to overdose them.
And so the ofloxacin that you like, is that a solution or is that an ointment?
It's a solution.
Okay, that's what I thought. Okay.
Well, hold on. I have a question for all of us regular folks here. So which would you say is, I guess this is a terrible question. You're going to say it's a dumb question. It depends. But which is better? A solution, if can you get it in solution, or an ointment if you had the choice? Which is actually a better case for clients? Because it's not me doing it. It's a client going home having to do this to their dog.
So in general, I would say that solutions are better tolerated. They're also better appreciated by the clientele. A lot of the ointments that we use, we shouldn't be using ointments if the ulcer is incredibly deep, because if the ulcer were to rupture and then we have that jelly and petroleum and ointment that goes inside the eye, we can do more damage on the inside of the eye, whereas a solution will not damage the inside of the eye. Every client's a little bit different. Some will prefer to use an ointment over a solution, and some like solutions more than ointments. Some of it comes down to cost. Sometimes the ointments are more expensive than solutions. So, maybe a client would use a solution to save some money. Yeah. And then species kind of plays into it as well. Horse owners would rather do ointments than solutions because it's very difficult to get that horse to turn his head sideways to get the solution in.
To get it to work, right. Yeah.
Right. Or a pug or a Frenchie, because you can't grab the nose and turn it, right?
But their eyeball's so big that you can just drop it in the general area and it usually hits them.
Yeah, you can just go from across the room. You'd gotcha. All right. It's so funny.
Awesome. Okay. So is there anything, because you've just talked about some really scary stuff, so I'm going to jump ahead a little bit and say, is there anything I can do to promote that ulcer not rupturing? Like, is there anything else? Like, I'm going to put my antibiotic stuff in there, but what else can I put in there that can help keep that from rupturing?
Right. So one of the things that you can use, there's been some more recent evidence to show that cross-linked hyaluronic acid will, as a lubricant, so you can use a lubricant that employs a cross-linked hyaluronic acid, and this will help epithelial migration move faster across the eye. So when we look at using these, we don't just want to use the cross-linked hyaluronic acid in and of it by itself, but from an adjunctive standpoint, with the usage of antibiotics, you can give that ulcer a better shot at healing.
Interesting. So for this ulcer, and I'm using, like Dr. GJ recommends, ofloxacin as my first-line empirical antibiotic. I'm adding in an adjunct of a cross-linked hyaluronic acid product to not only lubricate, because I just feel like that would, like, the eye must be on fire. So I'm going to lubricate, but that's also going to promote my healing because it's going to let the migration occur or kind of enhance that opportunity, right?
That's exactly right.
So when am I rechecking this? Because I know I'm not just sending them home and saying good luck to you, right?
That's right. In conjunction with all of that, we want to try to figure out the cause of the ulcer, if we can identify what is the reason why this ulcer occurred. Because if we know why it occurred, then that may also become part of our treatment plan. So, if it was a traumatic ulcer, such as, a dog I had a case one time where a dog jumped up in the air as the owner came home and threw a set of keys across the room to land on the couch, and the keys hit the dog in the eye. So we know what caused the ulcer. We know it wasn't a anatomic abnormality or anything like that. We know it was a traumatic event.
Lord!
We treat it and it ends up healing. But if we find out that it's,
and the dog was scarred for life. Anytime he heard the car keys,
no kid. That's what I was thinking. He's scared.
He was done after that. No more
duck and cover.
Yeah, no more greeting the owner at the door after that one.
Maybe with the other end.
Okay.
Anyway,
so traumatic ulcer, we know, like, we're just going to not do that again, right?
Yeah, and we know how to treat it and how to get by it. But if the ulcer is secondary to an entropion, then we know we've got to incorporate a surgical repair to fix the entropion and get the ulcer to heal.
And is that something I'm doing as a general practitioner, or are you recommending, like, when am I going to refer it, I guess is my question. Because so, like, at emergency clinics, like where I used to live and breathe, I mean, mostly for eyes, what I did was shove the eye back in, sew it shut, and refer them the next morning, and someone else could decide to take it out, right? Because you couldn't put it back in. If I took it out that night, I couldn't send it with the owner for you to put it back in the next day, so I didn't take it out.
Right. So this is a great question, and it's difficult to talk about to some extent, but it's fun to talk about, and that is that I don't know what every practitioner can do. So I don't know what their skill set is. I know what my skill set is. I know what my team's skill set is, and that's all I got. So it would be very self-serving to me to say, everything that develops a corneal ulcer or an eye problem should come see me. Unless
that's not going to happen. That's not the reality.
It's not going to happen, So that'd be very self-serving for me to say, and it's not real life. So I think you have to evaluate your, where is your comfort level, and no matter what your comfort level is, you shouldn't be embarrassed by it or anything like that. If there are people that are just awesome in general practitioners with eyes, and then there's people that are not so good.
That's not me. Jason, right. Is that you?
No, and I think that was my question. That's a very good point. So I think is if everyone understands, hey, I'm not the only one referring just a non-complicated ulcer because I just have bad luck with them. I shouldn't feel bad because we're not doing it for ourselves. We're doing it for the dog and what's best for the dog, cat, horse, or porcupine, whoever you're looking at. Send it to somebody that deals with this for a living. And so I think that's an important point that you just made, that don't be embarrassed. Send it off. You may be too busy. Maybe you got other stuff going on. It doesn't really matter. We've already mentioned eyes can't wait. So don't wait and send it off to somebody that can deal with it. So
you really have to look at it too. What is the risk here? What are you gaining if you do hold on to it? If and the risk is you lose an eye, that's a big risk.
Pretty big risk in my book. Yeah. Right?
So
that's a huge risk. But the other thing is sometimes clients don't really respond as well. They're not listening, I guess. They don't understand the gravity of the situation sometimes with their general practitioner because they see them all the time.
Right.
And so sometimes I think they might respond a little bit differently to, for instance, if it was Dr. Haeussler, the ophthalmologist telling him, you need to put this in 4 times a day and you need to not miss a dose, because your dog only has 2 eyes, versus their general practitioner that they see all the time, that might not have the same kind of oomph, with that direction.
It's true, but everyone can use the words, this may result in loss of an eye. And so, that's scary for anybody to hear, no matter who says it, And
yes, that's very true.
And it's not overly scaring people. I mean, you got 0.5 millimeters to work with. The risk is that you lose an eye.
I think I'm sorry to interrupt. I think that's a great thing, the great bit of knowledge for practitioners to have. Okay, you can see it on their face. They don't believe you. You can say, listen, you got this much to work with. We got to deal with this. If you don't deal with it, it's going to go away, and then you have a mess on your hands. Excellent point.
Yeah. And so one of the things that to kind of go back to what Dr. Jason was saying as well is that, one of the things I hear all the time from veterinarians is, I just don't feel comfortable treating eyes, or I don't feel like I'm good at it. Now, there are a lot of options out there in terms of CE and getting better and things like that. But if you want to refer it because you want to go back to things that you are comfortable at, that's an okay thing to do. Like, it's okay for the animal. It's okay for the client. It's okay for you, your team, and the ophthalmologist to just say, look, I'm not comfortable with this. I'm going to go back to doing what I am comfortable with, Yeah.
No, 100%. Like, I am very comfortable with C-sections.
Whereas I am not, okay? So like, if someone comes to me and says, hey, Dr. Haeussler, you're board certified. Why don't you do this C-section? The answer is no, absolutely not. I mean, no.
Not even thinking about it, huh? The answer is no.
No.
All week long, twice on Sundays.
This past weekend, one of my technicians asked me to help her out with some ear cytology on her cat. And I said, no, you have to go back to your general practitioner. You have to talk to people that understand this stuff better than me. I'm an eye guy, like that's all it is.
Yeah. And Jason is going to go back to hanging from a tree limb while looking at the sloth, right?
Yeah, that's what I'm comfortable with.
He's good at that.
Yeah, I've never done that, and I don't know that I ever will.
Yes, okay, but you want to. Everybody, I thought you were going to say I don't want to. Of course you would want to. Who doesn't?
Yeah, of course I would want to.
Absolutely, okay.
You could do an opto exam while hanging upside down with the sloth.
Oh, life goals.
Yeah, you got to do it very slowly, though.
Very slowly.
Life goals.
Okay, so I do have one more question, right? Just to kind of tie this up with a bow here, because you mentioned a couple of different common causes of corneal ulcerations in dogs, right? So the entropion, which we're going to fix by fixing the eyelid, so it's not turned in, it's turned out like it's supposed to be, and then just a trauma, right? Unexpected trauma, flying keys, that's still crazy. Running through the bushes, not closing your eyes, riding the convertible, holding your eyes open, those sorts of things. But are there other preventable ones and the causes? Because I'm thinking of something like KCS, right?
Right. That's right. So that is a hugely preventable cause of corneal ulceration, and something that you absolutely can get comfortable with as a general practitioner is tear testing and evaluating these animals as part of their routine examinations. Every 6 to 12 months, these dogs should be looked at for tear testing and where it's at, because you will catch them when they start to drop, and then you can treat them and you can help avoid some of these ulcerations. There's as dogs get older, they seem to develop dry eye more frequently. Diabetics develop ulcers and infected ulcers more frequently. So it's part of a good healthcare, a yearly healthcare plan.
And so I'm wondering, because earlier you mentioned that hyaluronic acid, the cross-linked one, you said it was good for a lubricant, and for that corneal ulcer that I had. Is it bad to use that? Like, because I'm sure you can use artificial tears, you can use all kinds of stuff, but can I use that as a prevention too?
You can.
Or am I just stuck with?
And a lot of these buggy-eyed dogs would greatly benefit from having a lubricant such as that 2 to 3 times a day. And I know that it sounds kind of funny, and I say it to my clients all the time, is I would not be in my OR at night as often as I am if these buggy-eyed dogs received, a couple times a day some lubricant.
Oh, wow. That's pretty incredible. That's powerful. That's powerful because, man, if you could prevent having to A, have your dog go through that, and B, having to pay for it as a client, that's incredible. That's incredible.
Dr. Haeussler, that's bad business, man. You're not supposed to give out those golden nuggets. What's wrong with you? What? Come on. You can tell the passion is there to save you. It's not about DJ. It's about the dogs. I love it.
It is.
There's plenty of work to go around. You know?
That's right. It's about the ocular support unit. He wants to take care of the dog.
We gotta save these eyes, man. You know, that's what I'm here for.
I love it. I love it. So I got one more quick question for you. What is like the number one mistake that you see general practitioners making? Say no names, please, Jason. But Dr. Haeussler, what's the number one mistake you see general practitioners making?
The number one mistake that occurs in veterinary ophthalmology, as it occurs to any other system in the body, is not looking. Every mistake that you make for not knowing, you make 10 for not looking.
Wow.
So is that along the lines of the Schirmer tear test? Is that what you mean by also not looking? If you just look at that, then you get some data, you kind of know where your dog is, and you kind of prevent some bad juju happening down the line.
You do, but simply putting a light in the eye on your physical examination, you will learn to see a lot of different differences and changes, and inherently you'll start to find some diseases there that need to be addressed. So I'm always surprised at hearing stories from clients and things that the vet may not have even shined a light in their eye right in front of them to as part of the physical exam.
Wow. Yeah, that's pretty incredible. But I'm really thinking about that, like your beginning database. And I'm wondering about adding that to like the geriatric dog exam, when they get to be like 8, 9, 10, we recommend blood work once a year, but I'm also wondering, like you said, a lot of dogs will develop dry eye as they age. I'm wondering about that Schirmer tear test being added in. Is it bad to do the Schirmer tear test if you're not going to stain the eye? Like if you're just doing adding to your geriatric dog profile?
You really should do that, and I'm also a big fan of making like a package sort of ophthalmology fee so that you do all three of them together, because inevitably, if you make them kind of an a la carte where you're charging X amount of dollars for a tear test and X amount of dollars for pressure, and you allow, the client to make that decision,
right?
Gosh darn it, it's just the, who's ever rule in the universe that they'll pick the wrong one. And then,
of course.
And then you can't do it. They don't want to pay for the other one or something like that. So I think you make it a lot easier if you say, hey, look, I think we're seeing some abnormalities here and it's X amount of dollars in order to do this ophthalmic database. This is what I need to do to do my job. I think that's a good way to go about it.
Yep.
Yeah, that makes perfect sense. Yeah, because you know what? That's what they do with us. Like I go to the ophthalmologist. It's not like they say, okay, here's what it costs for each one of these. So and I can be like, yeah, I don't want you to dilate them, or I don't want you to do this part. It's like you just get the bundle. Like you don't get an option.
Yeah, you just get the bundle and it gives you everything they need so that they can do their job, and you get the best treatment plan that way. Yeah,
that's wonderful. So, Dr. Jason, do you have any other burning eye medical questions for Dr. DJ, or can we move on to the always popular?
How can I possibly have a question when you covered everything I needed to cover? It's perfect. It's perfect. Let's move on to whatever you were going to say. Whatever you were going to say.
Wow, good job, Dr. Haeussler. I don't think he said that about a guest.
Holy cow.
We're going to move into the ever popular, I'm sure our producer told you that we like to play games with our guests.
Okay.
Yeah. Did she not tell you? Did she tell you?
No, but I'm happy to play.
She didn't tell him?
Yeah. No one's shocked. No vote, and no one's shocked.
Oh, mean trick. Okay.
It sounds like it'll be even more fun. I wasn't ready.
Yeah. That's why it's fun. Okay. So, on the internet, there's all kinds of fun facts about eyeballs and dogs' eyes in particular, right? And I'm sure clients bring you these fun facts and ask you. So we're going to play internet truth or lies about dog eyes.
Awesome.
Okay, ready? And we're going to get Jason to say if he thinks it's true, and then we're going to get you to say.
Yeah, big shock. Okay, I get to go first, right? Yeah, I can't just follow the expert. I vote that I should follow the expert.
Okay. All right, so here's a good one. Do dogs see fewer colors than humans do?
That is a great one, right? And I'm going to tell you, I'm just going to answer. This is not what I think. No, hold me accountable. I think dogs see fewer. Yes, I think dogs see fewer colors than people. I'm going to go with yes.
Dr. Haeussler?
That is true. They see fewer colors. Yes.
All right. He's starting
Do you know which color they don't see?
Ooh,
he's asking you, not me. I already answered my question.
Red?
Red. They don't see red.
Oh, it's terrible.
And I didn't Google that, friends. Candyverse. I did not Google that. Okay, so they just don't see red. That's
So
awesome.
stick with the yellow tennis ball.
There you go.
Yes, that's awesome. Okay, so the next one is, do dogs have 20/20 vision like humans? Like that's the ideal for dogs. Because a 20/20 in a human is perfect vision.
Right. Are you asking me that? Like, is that okay? Do dogs have 20/20 vision? Are you asking me that? I would think they would have better than 20/20 vision, but meaning 20/10. Like, I don't really know. So I would say they have better vision than 20/20. Is that even possible?
So you're saying no, they don't have 20/20.
Correct. They don't have 20/20. With the caveat, I think they have better vision.
Okay, we're just like, okay, Dr. Haeussler.
They have worse than 20/20 vision.
Oh, this is terrible. Not only did I get it wrong, I could have got it right. I just made sure I got it wrong, right? That's what I did.
So their visual acuity is worse than people, but what they give up in visual acuity, they pick up in low light vision. So they have the structure in the back of the eye called a tapetum, and the tapetum is a reflective structure that helps them see in low light conditions.
Eyeshine.
So they can see better at night than during the day. So, but a person's eye is more along the lines of like an HD television. They can see things more sharply.
Ooh. You know what? Maybe that's why the dog couldn't see the keys flying at him.
Maybe those keys were red.
Red keys in the daylight. He had no chance. Now, if they were in the dark, he'd be all over it.
He was doomed to begin with.
Okay. Here's the last one, Jason. Are you ready?
Yeah, listen, 1 for 3. No matter what, I'm good.
Cats do not get cataracts.
Cats don't get cataracts. So if I say yes, I agree, then that means I think cats do not get cataracts. Is that correct?
That's correct.
Okay, I agree. I don't think cats get cataracts.
Dr. Haeussler?
Cats get cataracts all the time.
No!
Oh, totally blew that one.
We can take those lenses out and put an artificial lens in and make them see again.
Oh, my goodness.
That's awesome. That's
awesome. It was named after him. It's a cataract.
I should have figured that out, right? Come on.
Okay, that's amazing. Okay, so that's pretty good. So Spaymaster J, Dr. Jason, was 2 out of 3. That's
not
pretty
bad.
good, Jason.
You're incorrect. I was 1 for 3.
Oh, well, you're only
I got the first one right. I got the second one wrong because I said they actually had better vision. I'm being very honest. Self-actualizing.
Oh, yeah.
And I completely blew the last one. I should miss 2 for the last one.
And you had a 50-50 shot at that one, too.
Yeah, life's hard.
Yeah. But Dr. Haeussler was 100.
Yeah.
He's batting 100.
Good for him.
I mean, I guess it's good he's an ophthalmologist.
Yep.
Yeah.
I try my best, you know.
That's right. You try your best. That is so awesome. Well, this has been super fantastic. The Dr. DJ Haeussler joining us in the Candyverse. And so what I'm going to do is the first news hound, right? Because this is all about ophthalmology. The first news hound that emails me at jen@myvetcandy.com, which creature in the animal kingdom has considered to have the best vision, right? The longest, like the best vision. I'm going to send you some swag, okay? Some vet candy and other news swag will be coming your way. If you email me, jen@myvetcandy.com, the first one to email me, the correct answer will get some swag. And we'll announce your name on a podcast episode, okay? So, yeah. So this has been wonderful, Dr. Haeussler. I'm so glad you joined us.
Don't go yet. I obviously need some ophthalmology CE, like no one's business. So can we put that out there where we can find that again? DJ CE. I want to write that down.
That's true. So, so for more great CE on ophthalmology from Dr. Haeussler, the Dr. DJ Haeussler, you can get that at myvetcandy.com/CE. The other thing is you can also download Dr. Haeussler's Guide to Corneal Disease for free on myvetcandy.com/I, as in eyeballs gross me out. Yep, /I. Okay, so it'll be awesome. And you do all kinds of stuff because we didn't even get into your hobby, which is amazing because you post incredible stuff on LinkedIn because of your photography and video hobby. In fact, in the first episode of Vet Candy Pop, we had that incredible surgical video. It was just incredible. So is there a website where people can find you and find some of your pictures?
Yeah, we have an Instagram account at Animal Eye Institute. You can find us on Facebook, also on Animal Eye Institute, and then on LinkedIn, it's just under my name, which is DJ Haeussler Jr. So yeah, it is one of my hobbies. I like videoing and showing some cool surgical procedures, and I love photography. I've loved photography for a really long time now. It's a fun hobby.
And it's incredible. The rest of us benefit by it because the pictures that you post of eyes, of retinas, just crazy stuff that you see on a daily basis. It's just incredible. They're really clear and sharp, and I love the explanations. Thanks. So check out his Instagram account. Don't go there at lunch or supper time. This is like a friend.
No, it's funny.
But we'll put all that in the episode notes, people. So don't run off the road trying to write this stuff down. It'll be on the website. Yeah. So from the Candyverse, this is Dr. Jen.
And I'm Dr. Jason.
And this has been a good time with Dr. DJ Haeussler. And we'll see you on the next episode of In Other News.
Let's Talk Pets. Every week on demand. Only on PetLifeRadio.com.